Hello dear audience, welcome to Health Comes First program today, and this is the first episode, and today we are in Medicis Hospital with Associate Professor Fahri YETİŞİR from the General Surgery Department, and we will talk about today metabolic surgery. And sir, welcome, how are you?
Welcome, thank you. First of all, thank you for a nice invitation to this program.
We appreciate for that. Could you introduce yourself, please, firstly?
Yes, my name is Fahri YETİŞİR. I live in Ankara and I graduated from the Hacettepe University in 1998. And after that, I go to general surgery and I become a general surgeon. After that, I start to work as a general surgeon. I have been working as a general surgeon since 2000 and I'm working 19 years as a general surgeon. During this period, I'm dealing lots of operation type, but especially I'm dealing with obesity surgery and metabolic surgery. During all this time, I'm dealing especially with obesity and metabolic surgery for approximately 17 years. This is very long time for some type of operation, and I have done lots of operation during this time period, and I have performed more than 1,000 operations about obesity surgery and metabolic surgery during this time period. It is because of that we learned so much thing, so much complication, so much operation technique about these patients.
Yeah, you especially specialized on diabetes and metabolic surgery.
Yes.
So, what is the metabolic surgery?
Yes, this is the very famous. This subject is becoming very famous approximately the last 2 decades. Before that, we do not know so much about metabolic surgery, but in the last 2 decades, metabolic surgery become so famous all around the world because, as you know, diabetes is a very important disease. Approximately 9–10% of the patients all around the world has diabetes. Because of that, if we deal with diabetic surgery, it is very important. If we can treat by the surgery the strong disease, we can go over with the surgery. It will be very important for all over the world. Because of that, diabetic surgery, metabolic surgery become very important all over the world. What is the metabolic surgery? If we try to explain briefly metabolic surgery, metabolic surgery is defined as the use of the gastrointestinal operation with the intent to treat diabetic patient, diabetes. We can explain in a briefly like this. This is a kind of operation inside the abdomen, like an obesity surgery, bariatric surgery, but we can make operation on stomach and intestine. During this time, our intention to treat diabetes. If we make an operation to treat the diabetes, this is called as a metabolic surgery.
Is it especially in stomach?
Yes, stomach and small intestine. We deal both of them.
Thanks. So, can metabolic surgery be applied to all diabetic patients?
No, we cannot apply all of them. First of all, if we make the division, which part of the diabetic patient we can apply only type 2 diabetes. Type 2 diabetes. We cannot apply type 1 diabetes. We cannot make any operation to treat type 1 diabetes. We can deal only with type 2 diabetes, but not only being type 2 diabetes is not enough to choose patient. There may be some criteria for choosing the patient. This is very important. First of all, patients have to be obese.
Yeah.
Obesity is important.
Especially for type 2.
Type 2, yes. And we can make operation, we can classify obese and non-obese. If there is a non-obese, we cannot make any operation to patient. Okay? If there is an obesity, we can classify obesity 3 types: class 1, class 2, class 3. We can classify the obesity according to BMI. If a patient has BMI 30 to 35, this is classified as the class 1. If patient has a BMI 35 to 40, this is classified as 2. If patient has more than 40, this is classified class 3 obesity. If patient has class 2 obesity and diabetes, we can we can recommend the patient operation, because this patient will get a successful result from operation. If patient has class 3 obesity and diabetes mellitus, in this kind of situation, if we suggest operation, if we do operation, patient will get so much benefit from this operation. Okay, because all the document, all the study recommend operation in this kind of patient. The second part, if patient has diabetes and class 2 obesity. What is the class 2 obesity? If the patient has BMI 35 to 40, in this situation, we give first of all medication to treat the diabetes. Okay.
Before recommend operation.
Yes, before recommend operation, we give medication and lifestyle change. Lifestyle changing, walking more,
sports activity.
Yes, sports activity and a little more activity, and make medical treatment. Okay, to treat diabetes. We look after the result. If control glycemia good, we can consider a metabolic surgery, but we cannot recommend. We can consider. We classify this patient. We can consider the metabolic operation, metabolic surgery operation. If patient need, if patient want, we can do operation. But if glycemic control cannot be good after this medication, we can recommend again metabolic surgery. Okay. Yeah. In these two situations, it's very important to make operation, because if a patient class 3 obesity and diabetes, we directly recommend the operation. Mm-hmm. If patient has class 2 obesity, in this kind of situation, we first of all make medication, and we look after the medication. If the result is good, we do not go directly to operation. We consider the operation, but we do not go to directly. If the glycemic control is not good, in this kind of condition, we recommend again operation, metabolic surgery. Okay. In the other class 1 patient, what is the class 1? Class 1, if patient has BMI 30 to 35, this is classified class 1. In this kind of situation, we give medical treatment, lifestyle change, plus injectable form of the medication. What is this? Insulin-like medication. We can add this injection, yes, injection of the insulin or insulin-like injection to body to control the diabetes. Okay. If we do lifestyle change in the class 1 and with diabetes patients, we do first of all lifestyle change and medical treatment and injectable form of the insulin-like insulin-like medication. We can give injectable form, and we'll look the results. If the result there is no good control, we can consider metabolic surgery again. Okay, if the result is good, if the glycemic control is good, we do not think anything about operation. We go over medical treatment. Okay, if the patient non-obese but has diabetes mellitus, we do not deal with this patient to operate, because
they are generally type 1.
No, not type 1. This is the type 2 also. But if if the patient has type 2 diabetes but non-obese, less than BMI, the patient has less than 30 BMI. In this kind of condition, we do not recommend operation. We do not consider operation. Okay. Only we consider the operation, we recommend operation more than 30 BMI. Okay.
Yeah.
Patient will have diabetes mellitus, and patient have to have more than 30 BMI. Okay.
Yeah.
First of all, this is the discrimination. This is the division of the operation.
For operation.
Yes. Yes. Okay.
Thank you. I'm gonna ask about mechanism. Yeah, what is the mechanism of this surgery? How it works exactly?
It is not so difficult, but it is a little bit difficult because how does surgery improve the diabetes? It is very incredible because if we look and surgery, doing a surgery, improving the diabetes, it is as I think it's impossible. But after doing this operation, I believe that we can do that. What's going on? First of all, we have to think it. By doing this operation, undigestible food come to distal part of the ileum. This is the very important key point of this operation. Undigestible food come to distal part of the ileum by doing this operation. What's happened after coming this food, this undigestible food coming to ileum? The undigestible food produce lots of hormone, lots of things in this part of the body. The distal part of the ileum is very important to control all of the body, because there's a lots of endocrine hormone, lots of paracrine hormone can be produced by coming this undigestible food. By coming undigestible food, first of all, gut hormone changes. Lots of gut hormones change. And I'm trying to briefly explain this situation. Bile acid change also occur, and nutrient sensing also change. What's the nutrient sensing? When the nutrient come to body, pancreas, brain, and gut get relation, and after that, patient feel fullness. Fullness and start to decrease eating. The patient don't want to eat so much. This is very important. Patient gets sufficient with a less amount of food and decrease the eating habit. And by this way, patient decrease the eating, patient weight loss, patient can easily weight loss, and blood sugar level decrease also by this way. Because when we take less food, our blood sugar level also decrease by this way. It is very easy way. The other second thing is pancreas. By coming this undigested food, send a hormone, some kind of hormone. This hormone affects the pancreas to produce so much insulin. And this insulin go through the blood and go to tissue and take the blood glucose level decrease. Okay. Mm-hmm. The other part is this by this hormonal change, all the tissue will be affected. All tissue become insulin sensitive. What does that mean by the insulin sensitive? It is the key point also. When the tissue become insulin sensitive, insulin can bind to tissue, all the body. We are talking all the body. This is the maybe fat tissue. This may be the muscle tissue. All of them
affected on.
Yes,
all,
affected.
All of the body.
All of them. All of them can bind to insulin and can take the glucose inside by this way. And glucose can work by this way. Because in the type 2 diabetes, there is a very big amount of insulin resistance. We can break down this point, and by breaking the insulin resistance, tissue become insulin sensitive, and tissue can take insulin, can take glucose from the blood. By taking the blood glucose inside the tissue, blood glucose level will start to decrease after the operation 2 or 3 days. Okay, it's very easy, but it is incredible. It is a successful result.
Yeah,
okay?
That's great, really.
Yes.
And the other one, what is the path followed in patients undergoing metabolic surgery?
Patient can contact our team by phone. First of all, patient can contact our team by phone, by mail, by WhatsApp, or by direct coming to our clinic, first contact happen. Patient can get first interview with free of the charge with one of the advanced metabolic surgery team. Okay. First of all, there's no any charge, free of the charge. Patient can come to our clinic, can phone or can contact with anyway, and patient can come to our clinic and can get an interview with a free charge. Okay, and get an idea about the metabolic surgery, can talk and can discuss everything, and he can understand what is suitable for these patients. Okay. If the patient is suitable for the metabolic surgery and the patient wants to have this operation, our team start to prepare the patient for this operation. Operative period, all the necessary tests and examination are made by the advanced specialist, and after that, if there is no contraindication, we can take a contraindication, we stop all the process. If there is no contraindication for the operation, we choose best surgery technique for these patients. We can choose according to some tests. After that, we choose the best technique and we discuss with the patient. We explain what is the operation, what is the advantage and disadvantage of this operation. We can talk and we can prepare patients also for the operation. After this, we decide the operating technique with the patient. Patient is hospitalized after 1 day before the operation, and we make a preparation all in this hospital. We enter this operation usually in the early morning at about 8 or 8:30, and because this operation may take 2 or 5 hours, depending on the operation type.
It depends.
It depends operation type, and after operation, patient may go to general surgery service or intensive care unit service. It depends the patient condition, but generally we do not need to go to intensive care unit. Generally, our patient go to general surgery service. After operation, first day is also important. All patients are monitored very closely because this patient is very complicated, because this patient has diabetes in a long time period. Because of that, this patient may have a heart problem, may have a liver problem, may have a kidney problem, and
the other organs.
Yes, the other organs may be affected by the diabetes. And because of that, we have to make a very good monitoring after the operation, during the operation, because this operation is not so easy operation. This operation is not a short time period operation, and these patients also complicated. Some of them has a very big body mass, and some of them morbid obese, and during this time period, patient may be affected. And due to that, we check all the parameters, blood parameters or the physical parameters. We control and monitor all of them. And we try to mobilize patient after 6 hours of the operation. This is very important because mobilization is very important. We choose the early mobilization of the patient because mobilization of the patient prevents so many complications. Okay. We mobilize our patient after 6 or 8 hours from the operation. And the patient start to drink water only in the first day. A little restricted water can drink.
Just drink water?
Yes, just water, and only 1 glass of water can be drink during the 1 day. And all the necessary liquid and electrolyte are given via intravenously. And blood glucose level are measured and controlled, giving insulin during this time period, because during the operation and after the operation, in the first 1 or 2 days, blood glucose level is high because our mechanism is not working yet, because after starting to eat, our mechanism will work. Okay, did you understand? In the first 2 days, we have to monitor, we have to control all the glucose level. Because of that, we are giving short-acting glucose during this time period according to patient need. Okay, and with blood glucose level control after that, start to work with triflu patient. This patient have to work with triflu. because lung function is very important. This patient is obese patient, this patient has diabetes, and lung function is very important. This patient after the operation have the work with reflux to make function good of the chest. In the second day, if we come the second day, all patients are monitored very closely, increase the mobilizations and working with the reflux, we increase the mobilization and patient forced to work with the reflux. During the second day, patients start to drink liquid food, also some fruit juice or soup-like food can start to eat, and blood tests are made all if necessary. We can test other tests also. Blood glucose level are controlled in the second day also. And after third day, we start more oral intake. After this time, blood glucose level start to decrease, and we start to decrease the insulin amount giving the patient, because we titrating the glucose level, and we are looking at the glucose level very closely, and when the glucose level start to decrease, we start to decrease the insulin amount given to patient. Okay. And we decrease the amount of the IV liquid at the same time, because patients can start to drink water 1 liter a day, and we decrease the amount from the IV fluid.
Thanks for a great information. We will have a commercial break. After that, we will be here again. Hello, dear audience. We are here again with Health Comes First program. Yes, sir. And how many days the patient stays in hospital after the operation?
It depends patient, it depends operation, but approximately our patients stay in hospital 5 or 6 days. In the fourth day is also important. We increase the oral intake of the patient in the fourth day, and after the operation we start to give vitamin supplementation and give all the energy to via the oral intake, and we stop to give IV fluid approximately at fourth day, and 5 day discharge patients. When we discharge patient, we have to explain everything to patient, and we give a receipt to patient. We give a diet list the patient during this time period after the discharge of the hospital, what this patient will eat, what this patient will drink after the operation during the first month, and we give the what to do also after the operation, and a phone number also.
It's a kind of diet list. Something.
Yes, diet list, and we give a phone number. This patient can contact our team, with our team, anytime, anywhere, because this patient may need some information, some emergency condition, and during this condition, patient can contact with our team and can come to our clinic, can come to our hospital. Okay, the first 10 days is very important, and a patient will stay in the first 10 days in our city.
You need to follow up the patient.
Yes, during the follow-up. The fifth day we discharge patient, but patient will stay 5 or 1 week in the same city, because a patient may need our help, and during this time period, patient will stay in the same city. And after 5 days, on the 10th day, patient will come to control again. We will check everything. We will check all the checklist. We will look all general condition of the patient, and we are look to wound, what's going on with the wound. If there is any problem, we can deal with it. Oral intake is also very important during this time period, because if patient cannot take liquid food, it's very important, because renal function will be affected if patient cannot drink so much liquid. Also, protein-rich and fiber-rich food can be advised, can be given patient need if there is a necessary. Patient will discharge at a 10-day period. In the first 2 years, we will check the patient every 6 months. After 2 years, we will check the patient every year, okay? Mm-hmm. This is the follow-up period. During the follow-up period, we will look micro and macronutrient status and blood glucose level. We can check everything. If there is any complication, the early complication or late, long-lasting complication, we will look all of them. If there is any problem, we can solve the problem. Because we have a very big metabolic surgery team, we can deal all kinds of the problem. Okay.
Well, yes. And the other important things, I think, can a diabetic patient quit all the diabetic medication and insulin injection after the operation?
Yes, after the operation, if we choose the right patient, and if we choose the right operation to right patient, and if we make operation in a good manner, after that, 95% of the patient can quit
it's
all
high
of them.
Rate.
It's high. 5% or 90% of the patient can quit injectable form or medical treatment of the diabetes, and it's a very good result for a medical treatment. It's we cannot reach this result by giving medical treatment. Because of that, metabolic surgery becoming more and more important all over the world. Okay?
Yes. Yeah. And the other one, what is the difference between metabolic surgery and obesity surgery?
Yes, all of them is metabolic surgery and obesity surgery similar. There is some similarity between them. What is the similarity? We are doing inside the abdomen, and we are doing the small bowel and stomach surgery in both of them. But there is some special difference between them. What is the difference? The aim is difference. In the metabolic surgery, we are dealing with the treatment of the diabetes. In the obesity surgery, we are dealing with the weight loss. This is the main difference, and there is a little operational technique difference, but it's not so important for the patients. Operation technique difference, and we choose for the patient. If there is a diabetes, we are not dealing with the weight loss especially. We are dealing especially with the treatment of the diabetes. If a patient has a obesity also, we are dealing especially with diabetes. At the same time, we are dealing with also weight loss at the same time.
Both of them. Sometimes you can use.
Yes.
Yes. What is the key word for the success in the metabolic surgery?
What's the key word? It is very important. Right patient selection is very important. We have to select patients, suitable patients. We have to select first of all. After selection of the suitable patient, we have to select the right surgical technique to right surgical patient. Surgical technique is also very important, because if surgical technique is not suitable to patient, there will be some problem after the operation. And experienced and advanced metabolic surgery team work also very important. Only one surgeon cannot do anything. If we want to get a success, we have to have a very good teamwork. Okay, yeah. It's very also important. And the other thing, qualified hospital is very important. Because we are using equipment, we are using a hospital. This hospital have to be very qualified during this operation, and we will get a success by this result. Okay, and good chance also very important.
Yeah, of course. Okay. What is the different exactly Medicis hospital in this surgery? Is there any innovation in this medical surgery or something machine?
It's a very qualified machine in this Medicis hospital. We have all the qualified machine, all the ICD room, all the operation room. This is the new hospital. Because of that, we have all the up-to-date machine, up-to-date operation technique, up-to-date ICD room. We have all of them, and we have a good team and a good colleagues also.
And lastly, sir, how is the metabolic surgery performed?
Metabolic surgery can be performed via advanced laparoscopy approach. 4 or 5 pores, a very small incision. We made the abdomen very small, 5 to 10 millimeter incision, length incision. We made 4 or 5 pores entrance side incision, and we enter pores from this incision. This is very little incision. We enter the abdomen, and we enter the laparoscopic camera via the port, and we solved all the abdomen. By under vision, we make all the operation. We make all the operation by under vision of the laparoscopic camera, and usually completed by laparoscopy. 99% of the patient completed by this way, and we do not go to open surgery, because when we make open surgery, we have to cut all over the abdomen. But in the laparoscopic surgery, we make all the operation minimal invasive approach by the entering a very small incision by the portway, and we make all the operation by this way. And what is the advantage of the laparoscopic surgery? Patient can get recover very well after the operation. Patient can walk, patient can do everything. Patient can eat, can walk, and can do everything after the operation.
Whatever they want.
Yes, after the laparoscopic surgery. If we do this operation by the open manner, patient cannot get well after this operation as the laparoscopic surgery. Because of that, we make laparoscopic surgery, and there is a advanced technique, advanced laparoscopic equipment, and we have all of them, and we can do by this laparoscopic equipment by this operation. Okay, laparoscopic surgery is very important, and we are doing all the operation by this manner.
Thanks for your great information, sir. Is there anything you wanted to add lastly?
Yes, I want to add, I want to invite all the patients from the America, from the Africa, from the Europe, from the Asia. They can come to us, they can contact with us if they have diabetic patient, if they have diabetes and morbid obese patient, they can come contact with us, and they can get successful results. Thank you.
Thanks. Yes, dear viewers, we came to the end of our program today. For the next week, we will be here again, Medicis Hospital. See you.